Hello and welcome. Today we're diving into a challenging condition affecting the urinary system, radiation cystitis. We'll explore what it is, what causes it, how it affects the body, and what can be done to manage it. Whether you're a medical professional, a patient, or simply curious, this video aims to provide a comprehensive overview of radiation cystitis. Radiation cystitis, as the name suggests, is primarily caused by radiation therapy directed at the pelvic region. This treatment, often used to combat cancers of the bladder, prostate, cervix, uterus, or rectum, unfortunately can damage healthy tissues in the vicinity, including the bladder. The likelihood and severity of radiation cystitis depend on several factors. These include the total radiation dose, the fractionation schedule, meaning how the radiation is divided into smaller doses over time, the specific technique used for radiation delivery, and individual patient factors such as pre-existing bladder conditions or certain medications. Now let's understand how radiation actually injures the bladder. Radiation damages the DNA within the bladder's cells, specifically affecting the rapidly dividing cells of the bladder lining, also known as the urothelium, as well as the bladder's blood vessels. Initially, this causes inflammation and swelling in acute phase. Over time, and in more severe cases, this can lead to fibrosis, which is the formation of scar tissue. The bladder's capacity may shrink, its elasticity decreases, and small blood vessels can become damaged, leading to bleeding. In severe cases, ulcers may form in the bladder lining, causing significant pain and complications. While precise global epidemiology data is limited, radiation cystitis is a relatively common side effect of pelvic radiation therapy. The incidence can vary greatly, reported anywhere from 5% to 75% of patients undergoing pelvic radiation. This wide range reflects differences in treatment protocols, radiation dosages, and how radiation cystitis is defined and diagnosed across various studies. It's important to note that the prevalence of long-term or late-onset radiation cystitis can also be substantial, affecting quality of life for many years after the initial radiation treatment. The signs and symptoms of radiation cystitis can vary considerably in severity. During the acute phase, which typically occurs during or shortly after radiation therapy, patients might experience increased urinary frequency and dysuria, which is painful urination. Hematuria, or blood in the urine, is also common. In more chronic or late-onset cases, symptoms can include persistent pelvic pain, incontinence, and the feeling of incomplete bladder emptying. In rare but severe cases, bladder fistulas, which are abnormal connections between the bladder and other organs like the vagina or rectum, may develop. Diagnosing radiation cystitis involves a combination of clinical evaluation and diagnostic testing. A thorough medical history, including details of prior radiation therapy, is essential. Urinalysis is performed to check for blood and infection. Cystoscopy, where a thin, flexible tube with a camera is inserted into the bladder, allows direct visualization of the bladder lining to identify inflammation, ulcers, or other abnormalities. Imaging studies like CT scans or MRIs may be used to rule out other causes of pelvic pain or hematuria, and to assess the overall condition of the bladder and surrounding tissues. Radiation cystitis doesn't have universally accepted classification system. However, it's often categorized by its onset. Acute radiation cystitis refers to symptoms that occur during or shortly after radiation therapy. Late or chronic radiation cystitis encompasses symptoms that develop months or even years after the treatment has ended. Some grading systems also exist to classify the severity of the symptoms, ranging from mild discomfort to severe bleeding and functional impairment. Management of radiation cystitis depends on the severity of the symptoms and whether it's acute or chronic. Treatment options range from conservative measures to more invasive procedures. Conservative approaches include pain management with analgesics, bladder irrigations to remove blood clots, and medications to reduce bladder spasms. For hematuria, medications like aminocaproic acid can help control bleeding. Hyperbaric oxygen therapy, which involves breathing pure oxygen in a pressurized chamber, can promote healing and reduce inflammation. More invasive procedures, such as fulguration to cauterize bleeding vessels, or even surgery to repair fistulas or in rare cases remove the bladder, may be necessary for severe or refractory cases. While completely preventing radiation cystitis is often not possible when pelvic radiation is necessary, there are strategies to minimize the risk and severity. Careful treatment planning and advanced radiation techniques, like intensity modulated radiation therapy or proton therapy, can help spare healthy bladder tissue. Maintaining adequate hydration during and after radiation therapy is also crucial. Some medications like amifostin have been studied for their potential to protect against radiation damage, but their use is not universally recommended and should be discussed with your doctor. The prognosis for radiation cystitis varies widely depending on the severity of the condition and the individual's response to treatment. Mild cases often resolve with conservative management. However, chronic radiation cystitis can be a long-term challenge, significantly impacting quality of life. Recent research focuses on developing more targeted therapies to reduce radiation-induced bladder damage and improve treatment outcomes. This includes exploring new medications, refining radiation techniques, and investigating regenerative medicine approaches to repair damaged bladder tissue. We hope this video has provided a valuable understanding of radiation cystitis. Remember to consult with your healthcare provider for personalized advice and treatment options.